afternoon. Thank you for joining us on CIGTV, YouTube, Facebook, and to our listeners on Radio Cayman. Welcome to this weekend coronavirus press briefing. I'm Caroline James, in for Donna Bush. I'd like to welcome the panel today, His Excellency the Governor, the Honourable Premier, the Honourable Minister for Health. And we'll start this afternoon with a medical update from the Medical Officer of Health, Dr. Samuel Williams Rodriguez. Thank you.
Good afternoon. Thank you. So just providing with an update. So far, we have tested 189 patients. 180 of them have tested negative. That's for a 95% negative rate. As we all know, we have 8 positive cases that have not changed. Out of those 8 positive cases, 6 are from City Cayman Island, and they were all associated with the first case that came from the cruise ship. We have 2 patients that were seen at the HSA, both of them with a travel history to countries with ongoing transmission of COVID-19. Yesterday, we were asked for an update about the patients themselves. We can report now that the 6 patients from Health City Cayman Island, as we all know, unfortunately, the first patient passed away. 4 of them are well, and 1 is admitted for long-term. It's a long-term admission for a different condition. He's stable. From the 2 patients that we're seeing at the HSA, they're both doing well. They're being followed up daily by Public Health Department. And as we all know, we have a patient with an inconclusive result that we have sent the sample to the Caribbean Public Health Agency, and we're waiting confirmation from them. We have another set of patients that have been tested today, and we should have that report for you either tomorrow or Monday. Also, I need to inform the public that Health City Cayman Island will be reopening for emergencies only, and the patient that they have tested positive there is stable, and he's in isolation. For the patient from the HSA, the one with the inconclusive result, the patient has been discharged, doing well, in isolation and follow up daily by Public Health Department. Contact tracing has been done with all the close contact, and we have taken samples from them, and also we'll be doing testing as well. I want to mention as well for the Sister Island, the Cayman Brac, they have a flu clinic as well. In the first week, they saw 13 patients. On the second week, they saw 6 patients for a total of 19. 3 patients have been tested, and I want to confirm that no positive cases have been coming from Cayman Brac. The flu hotline at the hospital, initially we were receiving 100 to 125 calls per day. Now that has gone down to around 75 per day. Yesterday, in the last 24 hours, we had 73 calls. By emails also, we are receiving approximately 10 emails per day. So that's the medical update. So if there's any questions, I'll be willing and happy to answer.
Do we have a technical?
Oh. Apparently, there's no sound on channel 23.
It's been fixed. So, do we need to repeat it?
Everything's good in the control room, I think, so I think we're just carrying on.
Okay.
Any questions from the media?
Yes, good afternoon, Dr. Williams, Reshma Raghunath, Cayman Compass. You said tests are being run today. Can you share some numbers of those tests that are being run today? Do you have that available?
Yes, 19 patients have been tested today.
19 patients, correct. Okay, thank you. You mentioned that Health City is opening 2 emergency services. How important is this announcement that Health City is now open to emergency services, and they're also, from a statement that they issued today, opening a separate wing for isolated patients to assist with COVID-19 testing and so forth? How important is this development?
Well, for the country, it's very important that Health City has opened the doors again for emergency. We rely in Health City as well as a partner of health service here in the Cayman Island. They have been in communication all the time with the CMO and myself, and we are comfortable now that they're open for business and good to go for emergencies only.
Okay. Now, a statement was put out yesterday that I think HSA has been visiting various buildings, also preparing for possible shelter facilities. Can you give us some information on that? Are you looking at other buildings for a possible hospital-type setup to prepare us for any additional cases?
Well, the CEO from the HSA is here, and she probably will be in better position to answer that particular question. So if you have another question for me, I can answer, and then the CEO can come and answer that question.
I'm okay with the medical. I don't know if anyone else has.
Okay. All right. Thank you.
Thank you, Reshma. That's correct. The Corona Preparedness Plan includes various phases based on the worst-case scenario. We're anticipating that we won't see that worst-case scenario with the measures that government has put in place. However, we are looking at another building for an overflow. Once the hospitals are full to capacity, we will be able to open another building, and more information will be prepared once that has been resolved and all the plans are prepared.
Okay, thank you. I guess it's too early to say what building will be used, but since maybe you can answer this question, if possible, Dr. Williams shared that the calls to the flu line are going down. Can you share why you think this has been happening? Is it and what it means for us as a community?
That's a very good question, Reshma. I think that that's a very good indication that the measures that are being put in place are taken seriously by the public, and I would implore everybody to continue to abide by the measures that are in place, because that will reduce the number of contacts that we have and ultimately reduce the transmission. So, originally, I think the calls were coming in because people were very anxious. They wanted to know whether they were a candidate for testing. I think the information has gone out about the criteria for testing. People now understand, and they are coming forward still with questions about those that are having symptoms. Now, what we want to ask the public to do is that even if you have mild symptoms, we still want to encourage you to call the flu hotline so we can know whether you are out there with flu symptoms, even if they're minor at this point in time and don't require you to come to the hospital.
Thank you. I don't know if you can speak to this, but yesterday a statement was issued with for the emergency services like 911, police, and other first responders that people advise them before they respond to emergencies if they're experiencing any sort of coronavirus type symptoms. Can you speak to that as well?
That's right. So we are asking persons to, when they call 911, in order to let us know whether the persons who are responding should be prepared in order to receive them with the flu symptoms. We're asking them to tell the callers. However, 911 call takers go through the same algorithm that we go through at the hospital. So they will actively ask questions to find out if the person who is calling has flu symptoms. And the EMS personnel are fully prepared in order to receive those individuals.
Okay, thank you.
Do we have any further questions from the media in relation to the medical update? In which case, I would like to invite Commissioner Byrne. Many of the questions I'm receiving from the public are in relation to the soft curfew. I think it would be a good time, sir, to invite an update from you.
Good afternoon, everybody. Maybe start by giving an overview of the overnight activities. Crime remains very stable and the policing environment is extremely calm. The nighttime curfew is operating well and we have almost full compliance. Little Cayman overnight, no issues of any type arising. Cayman Brac, 71 vehicle interceptions, 2 persons found to be in breach of curfew, warrant for prosecution, no requirement to arrest. During the night in Cayman Brac, there was a very serious assault on a female. The suspect, a male, has been arrested, transported to Grand Cayman and is currently in our detention centre, and the matter is being investigated. Turning to Grand Cayman, during the night, 66 vehicle interceptions, 5 persons found breaching curfew and warrant for prosecution, no requirement to effect arrest. And with your permission or forbearance, I'd just like to talk a little bit about the curfew, the soft curfew that came into effect at 5:01 a.m. this morning. And up until immediately before I came to this media briefing, there has been a lot of movement around Grand Cayman. And from a policing perspective, quite frankly, in this current climate, I would think that's not justifiable or sustainable. I do have a genuine concern that persons in the community have not understood the serious situation we are in. In this regard, I remind our communities that the soft curfew is an alternative to a hard curfew or a full lockdown. The soft curfew came into effect this morning, provides for limited exemption activities only to allow persons to do certain things which are set out in the regulations, and effectively, in short, those are conduct business which are part of essential services. To prepare for this morning, the RCIPS, I and my command team worked overnight in partnership with the supermarkets and retailers to deploy extra uniform patrols at various supermarket locations around the island throughout the day today. Our shared objective was to create a positive and safe environment for persons to move around and conduct their essential business. The message is from me, please be assured that the major retailers are well stocked to meet the demands of the community. It is essential that all persons adhere to social distancing requirements inside and outside the supermarkets. It is in everybody's best interest to work together to comply with these measures. The RCIPS is out to assist and provide public reassurance during this extremely challenging period. And if I could just maybe highlight some of the issues I've come across this morning, or the teams that are not provided for under the regulations. Landscaping business is operating as usual. This is not provided for in the regulations. It is a breach of the regulations, which in itself is a criminal offence. I turn to liquor stores, and I do have some concerns about the way they are being run and managed. There appears to be large bulk buying, and social distancing requirements are not being adhered to, and I must stress, only in a small number of cases. In one particular case, persons were congregating outside of the liquor store drinking. This is a breach of the regulations and is a criminal offence. We have large numbers of persons sunbathing on our public beaches. This was not really envisaged in the regulations and the soft curfew. This is forcing the RCIPS to look at the way we are managing the situation, and if the curfew is to be effective, the police service will need to be far more intrusive. This is in the absence of full cooperation from all persons in the community. I should remind all persons that the nighttime curfew remains in place from 7 p.m. each evening until 5 a.m. each night until at least Friday, the 3rd of April 2020. I make the comment that it is far easier for the police and much more effective to enforce a full lockdown or total curfew than it is to enforce a soft curfew. This evening, RCIPS personnel, supported by our Special Constabulary and our colleagues from CBC, will be out in large numbers performing checkpoints and enforcing the curfew. And as I close then, despite what I have said, I do need to acknowledge and thank the community of the Cayman Islands for their cooperation and continued support as we work through this difficult period to contain COVID-19. And I earnestly ask for your full cooperation and good nature during this challenging period, but highlight again that we are in curfew mode, which for the time being is soft during the day for essential business only, with full lockdown during the evenings after 7 p.m. When this position changes, everybody will be notified. Thank you.
Commissioner, today we got reports, and you've just mentioned it, there were almost hundreds of people at supermarkets, and they also closed the farmers market. Were there any other businesses that had to be closed because of the public not adhering to the specifications that were issued yesterday?
Very small numbers of pop-up businesses by the side of the road that weren't authorised. And unfortunately, that was the case of the farmers market. It hadn't any exemption, and we had no option but to go. And in fairness to the persons operating there, they dispersed immediately upon request.
Okay. In terms of the liquor store and people congregating outside and those consuming alcohol outside of it, were there any arrests, or is there any sort of criminal offence that, given the circumstances that we are in, that these persons are or possibly face if they continue this practice?
So I'll answer that by saying that no arrest was affected, names were taken, warning for prosecution was issued, and it goes back to my point earlier. I do not think that some people understand the serious situation we were in, and do not understand that the soft curfew is an alternative to a full curfew, provided for very good reason to allow people to conduct essential business. But it does seem that the message is not getting through.
In terms of the individuals who were in the line waiting, were they well behaved? Were they? What kind of response were you getting from your officers?
So the supermarket situation is working quite well. Unfortunately, there are long queues, but that was envisaged in the planning stage, and the supermarket retailers are doing all they can to facilitate their customers. They must comply with the social distancing requirements, and the police are there to help with enforcing that social distancing. For the most part, people are very good-natured in the supermarket car park, but we are seeing a lot of other traffic on the road. And as I said, I really don't think that's justifiable or sustainable in the emergency situation we're in.
I'm just curious, and maybe this might help get that under control in terms of the penalties. I know you talked about $3,000 fine and a 1 year imprisonment, but maybe for public understanding, work permit holders, for example, if they are fined or charged under this breach, would it translate to their work permit and impact it as a criminal offence?
We deal with the law as it is, which provides statutory fines and imposition of fines and other penalties, including imprisonment, and it doesn't go beyond that.
Okay, thank you.
Good afternoon. With what you saw this morning, would you recommend that we go back to the hard curfew, or would you give it a couple of days to see what happens over time?
Okay, so as a police service then we'll be guided by government in terms of the direction we're taking, but I do think there's going to be a very serious conversation to be had to find out where we are, how today went, and how we're going to take this forward for the safety of the community. Thank you.
Thank you, Commissioner. Before we move to the panel, we have had one question come in from Cayman News Service for the medical team. My apologies for not getting to that before. The question is, just to clarify, how many sick people are at the hospital waiting on tests at the moment? I suppose that would also count how many in isolation waiting for tests. Thank you.
Well, none of the patients that have been tested at the moment are at the hospital. None of them have been admitted. They have symptoms consistent with COVID-19, and some of them have a travel history, so they meet the criteria for testing, but none of them are admitted at the hospital at this time. Thank you.
Thank you. We'll move to the Honourable Premier for his update, sir.
Thank you. Hello, everyone. I'll start with my usual Grim Reaper report. Today, at last check, just a few minutes ago, the total number of recorded deaths globally, 650,926. Sorry, cases. The total number of deaths, 30,299. In the U.S., 116,448 cases. up 12,000 overnight. Number of deaths, 1,943, up 247 overnight. In the UK, number of cases now 17,098, up 2,546 overnight. Number of deaths 1,019, up 26, I think. 260 overnight. In Italy, 92,472 cases, up 5,974 overnight. 10,023 deaths, up 859 overnight. In Spain, 72,248 cases, up 6,529 overnight. 5,812 deaths, up 674. In New York City, 52,318 cases. Not New York City, New York State. Up 6,056 overnight. 728 deaths, up 122 overnight. And then what for me today was the most chilling statistic or projection was that the UK have said that if they can limit the deaths from COVID-19 to under 20,000, it would be a good result. I say all of that in advance of what I'm about to say to underscore the point that the Commissioner made about the importance of all of us who live here to take seriously the threat that we are facing and not to take the current set of results of which we are all very happy for granted, or to believe that because we are where we are with that the threat has gone away. It has not gone away. We still do not know the extent to which there is community transmission of the virus in these islands. And it will be some weeks before we can be anywhere near certain about what the status is, which is why we have employed these measures. I said yesterday how proud I was and the government is of the way the community has responded to the hard curfew. Unfortunately, since the soft curfew has come into effect, I can't really say that up until now. The situation with the supermarkets in particular, I want to address that. The governor and I urged everyone not to panic buy, not to go to the supermarket if you didn't absolutely have to today. But those words appear to have gone completely unheeded. While the supermarkets, from the reports I've gotten, have done an excellent job, are doing an excellent job in ensuring social distancing and limiting the number of customers in the establishment at any given time, the result of that is very, very long lines, sneaking, in some cases for the best part of a quarter of a mile. And based on the photographs that I've seen and the videos I've seen, there are many people who are not employing social distancing practices there. I want everyone to understand that the person standing next to you may well have COVID-19, and you're standing 2 or 3 feet from them, or even closer, could mean that you contract it. We have to treat everyone around us as though they are contagious. That is the only way we are going to be able to ensure that we limit the transmission of the virus throughout the community. Now, the Commissioner spoke about the hard curfew and how much easier that is to operationally to enforce. But the reality is, we know that we cannot put in place a hard curfew for an extended period because everybody has to eat. Everybody has to get out for medicine or something or the other. But we do, for the soft curfew to work, we do need people to cooperate, exercise common sense, and follow the rules. There are some businesses who just refuse to shut. I myself got reports about landscapers. I got reports about some construction as well. People carrying on as though it is business as usual. It is not. All businesses which have not been exempted are closed. And everyone needs to understand and appreciate that. Coming back to the supermarkets, it is clear that we are going to have to find a better means of ensuring that everyone gets adequate access to the food they need, but that we don't wind up with these excessive queues, excessively long queues. I want to assure everyone that the supermarkets are not going to be shut. I want to assure them that the supermarkets have more than enough product for everyone. We just all don't need to turn up at the same time to get what we need. It is also clear to us that there is today significant abuse of the privilege to move around. I think up until between 5 a.m. and 10 a.m., the vehicle reader in one of the key area recorded more than 15,000 trips. And 10,000 plus of those were unique vehicles. We've got reports of hundreds of people sunbathing on some of the beaches. That is not the plan, and that is not going to work. Folks, Cayman, as I said, is in a very good place at the moment, but we simply do not know for sure the extent to which there is community spread of this virus. So we have to operate as though it is everywhere, and we need people to stay away from each other. We need people to stay home. If this is soft curfew in its present construct is not going to work, we are going to have to make adjustments to it. And that is going to mean that it is going to become necessarily more restrictive. It is the last thing we want to do. But we cannot expect the commissioner and his team to do more than they are currently doing. I need everyone to understand that we don't know how long we are going to have to be in this particular state where there is limitation on movement and a nighttime curfew. Everyone should be paying attention to the international news and see what's happening all around us. We need to understand that this is a state that we may have to continue for some significant time to ensure that our people are safe. So let's get used to the idea that we can't live like we normally do, that we can't just jump in a car and drive down the road to see my good friend Bob. We can't do that in these circumstances. Let's work through the next week, and if necessary, the week following that, and see where we get to. We've had only one death, and that unfortunate man was the visitor from the cruise ship. So he came here with the virus. I don't want one single one of my people, and I'm including those who reside here who are not Caymanian, to die of this disease in Cayman. That's what we're aiming for. It could be you, it could be your mother, your grandmother, your sister, your auntie, your uncle, your father, or it could be you. Come on, folk. Let's do this together. Let's cooperate with what we're trying to do. No one is intentionally trying to make your life more inconvenient or difficult. We're trying to save it, and that of the rest of the people in our community. Please help us.
Thank you very much, Premier. I mean, that global situation does remain incredibly worrying, and it is a really shocking statistic for me that today in the UK we're over 1,000 deaths. And I think what I would just like to say is that the government, led, I think, brilliantly by our Premier, have taken some really decisive actions and taken them early to give us a chance to contain this threat. So let's not throw that away. What we've seen this morning is hugely disappointing. As the Premier has said, the supermarkets are not going to close. The supermarkets will remain open. So there is no need for panic buying. There is no need for everybody to rush to the supermarkets. Stay home Cayman means staying at home, and we're asking people to stay home to save lives of our vulnerable and elderly. So that means only going out if it is absolutely essential. I do commend the police commissioner and his team. I think they're doing a fantastic job in the circumstances, and I'll certainly be speaking to the commissioner and the Premier about what more we can do to toughen up our stance in terms of how we police the soft curfew. I think that will need to be looked at if some of the things we've seen this morning continue. So I just urge everybody, please, to be responsible, and please all help everybody to contain this very serious threat that we have. I think we all feel that COVID-19 must be out there. We're not seeing it. We're not seeing it in the people that are coming into the flu clinic and into the hospitals. We all feel that it has to be there. So please, people, do not underestimate that threat. We've got ourselves into a very good position. Please don't squander it. Thank you.
Minister.
Thank you. Good afternoon, Cayman Islands, Cayman Brac and Little Cayman included. It's such a blessing to be here to address each of you today. I thank you all for paying such attention in great numbers to these press conferences. And thanks for the well wishes and encouragement and prayers for the government and all of the essential staff. Even though we continue to awake hearing more bad news from all over the world, as Premier reminded us of, there's still so much to be thankful for. And as you all are aware, we're now officially under shelter-in-place orders. In order to help us get through these next 7 days, I'd like to suggest a few things that were laid on my heart to help us rise to the occasion. For the next 7 days, let us all pledge to live by the principles of putting others first. Let's all act with accountability. After all, we are brothers' keepers. For the next 7 days, let's leave stress outside, enjoy family time, go back to old days of family meals, around the table where we bowed our heads together in thanksgiving for God's grace. For the next 7 days, let's practice good hygiene often, enjoy the foods that are already stocked up in our fridge, and come out less to shop. Let's dust off board games like Monopoly and Ludi, and teach our kids how to play. If you got some gigs, to teach them that too. Let's celebrate culture while we're at it. For the next 7 days, eat healthy, exercise in your yards, in your living rooms. Use the next 7 days to really work on your own physical health. For the next 7 days, make calls to check on the elderly and most vulnerable. Let them know that along with the government, everyone in the community has put their lives and safety first. Show that Caymankind spirit. For the next 7 days, a few minutes to slowly inhale and exhale. Meditate and give your mind a break. Share and laugh together. Laughter is the best medicine. Sing songs and create art together. For the next 7 days, I challenge each of you to pray prayers of thanksgiving. Our situation could be so much worse, but because of fast actions and compliance by the people of the country, we are containing a virus that could potentially wreak havoc applaud yourselves, please. For the next 7 days, challenge yourselves not to share information or rumors that only heighten fear and anxiety in the community. Instead, pledge to share 7 things that you're grateful for, as well as 7 acts of kindness that you have done or seen. Share them with your families at home. Also share them on social media with our communications campaign, hashtag staying home is Caymankind, so we celebrate along with you too. Starting next week, both Talk Today and For the Record will invite callers to share their stories in a little segment we call Caymankind in the Time of Coronavirus, which will invite you all to call in to share your stories of kindness you've seen or done. In our opinion, 60-year-olds are considered seniors, anyone over 60 years old. I know the Premier doesn't like that. And they should be given every opportunity to get in and out quickly. And I also want to say, in our opinion, essential staff is not admin staff, receptionists, accountants, lawyers, etc. Not that these persons are not important, but with this blur, what we're trying to achieve. The Ministry of Health has the primary responsibility for developing health policies and programs. And as Minister of Health, I have ensured that the Public Health Department, HSA, has all of whatever they requested financial-wise, and we are there for them whenever they say. We are still in the process of trying to source nurses and doctors and other medical personnel from our neighbors. As you've seen around the country, such as St. Lucia in the region, such as St. Lucia and Jamaica next door, getting medical support from other countries. We want to be prepared, and the government is raring to go. The documents are being prepared for us to ensure that we are ready. I'm asking you, even though restricted in your movement, to stay fit. As experts say, a healthy diet will reduce the risk of becoming severely ill with this virus. You should exercise, have alcohol-free days, I know that's hard for some, and quit smoking. Measures such as these could make it less likely you'd be admitted to the intensive care. Experts in China, where the virus originated, found that smokers were 3 times more likely to have a worse outcome. I know from the comments, people find hope in my spiritual contribution and prayers, and this is not uncommon. As a government, we pray in cabinet every week, as we know God has his hand in every government, and each day I'm reminded as I awake. Fear not, I am with you, be not dismayed, for I am your God, I will strengthen you. Yes, I will help you. I will uphold you with my righteous hand. Isaiah 41:10. Remember, a hungry man or woman is an angry man or woman. Share with your neighbor. Don't take the low positive numbers in Cayman for granted, as our situation could change in a snap. So just stay home, not just to save your life, but to save the nation. Social media, we're asking you to help us with this. God bless.
We have one question from the media already from Radio Cayman. Premier, whether your government would consider working with supermarkets to designate a reservation system for grocery shopping and other essentials to alleviate some of the actual physical presence outside the supermarkets.
We are working with supermarkets on all of this and the various options. And I do expect that fairly shortly we'll announce some adjustments to the current arrangement, which clearly is not acceptable. So we're talking to them about all sorts of possibilities to deal with this. If I did miss one point, money transfer businesses are also closed. They are not exempt and are not exempted. And there's been quite a bit of that going on this morning as well, and there's good reason for that. It's to do with the social distancing aspect of it. So they're not declared as essential services, and they are not to be open. A number of them are in breach of the regs this morning, but the commissioner and others are being fairly lenient because this is the first day, but they are not to be opened.
Thank you. Reshma?
Premier, this is for you. In light of what we've seen today and in light of people flocking to the beach to sunbathe, is government contemplating closing the beaches to the public?
It may come to that. It would be most unfortunate. As I say, today is the first day. We've warned about this over and again. But as I said, this is not going to be a short-term exercise. It is clear to us that we are going to have very different kinds of behaviors than we are used to for quite some time until this threat is passed. And if we don't get the cooperation of the public, unfortunately, as happens far too often, the innocent will suffer for the guilty. Because if the commissioner tells us tomorrow, listen, I can't enforce this, we're going to close the beaches, then no one will get to go there. And anybody that the commissioner's people see there, they will know are in breach of the regulations. That's what people need to understand, the consequences of this irresponsible behavior, this selfish behavior, quite frankly, is that you force the government to become more and more restrictive to get it to a position where we can actually enforce the rules. So I appeal again for people to be reasonable, to exercise common sense, and to follow the rules. Otherwise, you make life harder for all of the people around you, all of your friends and neighbors and family who will be deprived of access to the beaches because you decided you want to have a party.
And Prem, I think the regulations are quite clear. That what it says is that you can go out for 90 minutes for exercise, whether that's walking a dog or going for a walk or jogging. So nobody should be sunbathing on the beach. That is not in the spirit of those regulations.
I had a question come in, and it builds on the point that you would have made earlier that we are not sure about community transmission, so act as if it is out there. Is government going to embark on any sort of nationwide cleanup, sanitization of public spaces, play parks, those kinds of things, so that we ensure that these places are safe and clean? I know we do the street cleaning and stuff like that. There's already that in place. But in terms of a national sanitization campaign, while people are in the soft curfew and hard curfew.
That, Minister, you can speak. That is not the greatest threat. The greatest threat is the behavior of people. People not observing the rules about social distancing and staying home. Those are far greater threats to the national health than worrying about sanitizing the beaches or parks.
The Premier is quite correct, but I just want to say the government has been in discussions with MRCU about spraying and finding a chemical. Like we could spray throughout the towns and out and about. Nothing has been confirmed as yet, but we are working aggressively on it.
I have two questions. The first one is for the governor. Do you have an estimated time of arrival for the supplies from the UK?
I think there is an update on that. Probably better if HSA provide that, but there was some more positive news this morning. So I don't know whether Dr. Williams.
Yeah, the HSA has received already some of the reagent for testing or to continue doing PCR testing. So those ones are already on island, they're already at the HSA. Okay.
Thank you. Thank you. Yes, we have a question. Can you say how much test kits were received?
Yes, we have enough material to test another 480 patients.
480.
That's correct.
Thank you.
And I might just add that I think is the non-UK deliveries that have arrived. The UK's are being sent and should be here as well. So that will give us, I'm not quite sure exactly how many are in that, but another large number of tests. So I think the situation on that is clearly a lot better than it was.
My next question is for the Premier. And by this line of question, I'm trying to give some hope to our people out there. If everyone was to follow the rules and do what they should do, would you consider opening up business in the 7 days so that business can start opening and start generating some revenue? And this whole line of questions, I'm concerned that for our residents who are losing their savings and their ability to buy their foodstuffs are being minimized because maybe the panic buying in the past have depleted their funds. And we get a lot of questions regarding finance, personal finances. So the question again, if everything went fine, we follow instructions, after 7 days, would the country be allowed to go back to business as usual regarding commerce?
Not in 7 days. Not in 7 days. Simply not enough time would have expired based on the advice we have as recently as just before I came in here, in terms of public health, for us to be certain that the virus is still not lingering in the community, not in 7 days. We are not at all unsympathetic to the financial hardship that this causes, the economic woes this causes. In addition to what was happening globally, we know we have crashed the economy. But let me say this. We can rebuild the economy. But the only person reputed to have been able to raise the dead was Jesus Christ himself. We cannot bring back lives.
So would you remind our listeners to be frugal with their spending, cut back on maybe non-essential needs?
But I'm glad you make that point. I mean, when I see the amount of panic buying that is going on, I ask myself, if people spend up all of their money now, what about next week and the week after and the week after? Even when the curfew is lifted, the economy is not going to bounce back miraculously. Look at what's happening all around us. People need to hoard what money they have. Eat frugally, sparingly. Personally, I've been through more than one hurricane season. Alden can live on a couple of cans of corned beef and white rice for weeks. We don't need to have ribs and steaks and chicken every single day. Let's just calm down. Think of this as I've said this before, a long hurricane that we're trying to get through.
Just to add to what Premier said about opening up or lifting measures, with more test kits arriving, I think to make us feel a little more comfortable, we'll be able to change our approach in terms of testing and not be so frugal in the way that we're testing now. So that would make us as a country and as a government feel more comfortable that the people that are here on this island, we're pretty much certain that it's not amongst us, and that we could be more free to open up and lift some of the measures that are here. But we ought to be reminded when we talk about lifting the measures that are here, that our borders still have to be secured until the trajectory of the USA and Jamaica, that are our neighbors, go in the other direction. Every day we hear that it's rising in the US and rising all around us. So we need to see that stabilize first and go in the other direction before we even think about opening up our borders. I know that we sympathize with, there's a lot of Caymanians who have been stuck in places like Honduras and Jamaica and other places, Canada and even the USA. and they want to know when their family members can come back home. But that would be against what we're trying to achieve and trying to figure out in the population that we have here on the island. That's the reason why we locked down the borders, to try to figure out what our real situation is here on the island.
A question picking up on what the Minister has just said, but perhaps for the Governor. People asking whether you can give an update on the emergency travel team and how they've been sort of getting along and how many people have been able to get out.
The travel hotline that we set up has certainly had a number of people ringing it. It's not a huge number of people at the moment, but we do know that if we get this air bridge, which we're working on very hard, and I do believe we will be able to arrange, once we can say that there is a possibility to depart, a lot more people will come forward. But if people do have concerns, please ring that hotline for advice.
And that hotline number for concerned people is on gov.ky/coronavirus. Kevin?
Kevin Morales, Cayman Compass. Minister Seymour, you had just, I believe you'd said, be less frugal with how we conduct our tests. Can you get into a little bit more detail about that and maybe what that looks like to you? Does that mean testing people who are asymptomatic or random testing, or what do you mean by that exactly?
Well, I could delve into it, but I won't, and I'll allow the medical officer to go a little further. I think he understood what I was trying to say.
Yeah, basically what we're trying to do, and we are actually analyzing, is once we got more testing capacity on the island, we will expand the group of persons that we will be testing. And we have a plan. We definitely need to discuss that with the rest of the Canada and the government. But yes, it will basically mean that to expand testing farther than what we're doing now. Now we're following strictly the criteria from WHO, but we'll definitely expand testing as some other countries have done, and they have been successful. And we'll go that route once it's decided, and once we have the testing capacity on island to do that.
Dr. Williams, you had said, just to confirm the numbers, you had said we had received an additional 480 tests, or we have the capacity total for 480?
An additional 480 tests.
So do you have a rough estimate of how many tests we could do right now?
480 patients. However, we have received 480 tests. Sometimes a patient will need more than one test because you have to repeat it and things like that. But we should be able to do definitely more than 400 patients right now. But we're still not in the position to go ahead and expand and test across the area like this. We will continue, at least for now, with following the case definition provided to us by WHO.
So I just want to confirm, and I'd love if you guys could clarify for me. So if we received an additional 480 tests, and we have the capacity for 480 tests, did that mean we ran out of tests for a period of time?
Oh, no, you wanted to, no. Definitely we have like around 60 tests left, and we have received 480.
I see, okay. Thank you very much.
That's clear now? All right, thank you.
Cool, thanks.
But in any essence, we still, in my calculation, have almost 7 or 8% of the population in terms of test kits that we had arrived.
Sorry, could you repeat that? 7 or 8% of the?
In terms of our 65,000 population.
I see.
Yeah.
Thank you.
Which is, it's still better than most places.
Thank you.
Thank you. I had a question come in overnight in relation to the curfew and shelter-in-place announcement that was made yesterday. The Attorney General had said that the shelter-in-place would go for 10 days. That commenced from today. And the curfew is ending on Friday, which would be some days of difference. Can you explain this or clarify how it's going to work? Are they working in tandem? Are we going to be extending? Can you explain that to the public?
Right. So what we've now started everybody to term is the hard curfew. That is from 7 p.m. to 5 a.m., which is pretty much a complete lockdown. Started on Wednesday night. So the shelter-in-place provisions started this morning. So obviously both were for 10 days, so one will end before the other. But certainly the plan is to extend the hard curfew through whatever period the shelter-in-place order remains in effect. So the two will continue to run together. It's just that the initial order was made for 10 days, so that will have to be extended.
Okay, so those dates are not hard and fast dates.
No. As I say, this thing is constantly evolving. God forbid, but should we get evidence of significant community spread, we would quickly become far more restrictive than we currently are in what we're doing. Especially since the early indications of how well the soft curfew is being obeyed aren't terribly good.
Thank you.
We have a question from our viewers and listeners in the sister islands who are concerned about flights between Grand Cayman and Cayman Brac in particular, and whether those flights have been restricted to essential personnel only while the priority is stay home Cayman, and how that's being enforced.
Yes, it's supposed to be operating the way that we said from the beginning, which is it's only essential personnel and returning residents. No visitors to the BRAC, even if they are Caymanians.
Thank you. Any other questions from the media? We had one more, which I thought might be a rather nice note to end on. A question for each member of the panel. What are you doing personally to keep busy while you stay home, Cayman?
I wish.
Stay busy?
To stay home. What are you doing when you're at home?
Well, in fact, we almost had about 16 press conferences now. My family would love me to stay home. But when we stay home, I try to just take the kids around the house a little bit so they don't go crazy. And, when I get home, I actually practice taking my shoes off and spraying them with Lysol, which is a good measure for everyone to take. And automatically I spray my clothes as I get home and take an immediate shower, which is a good practice again for persons. And then I try to catch up on the sad news on CNN.
Well, I think because we're all at home using social media to talk to sort of friends and relatives, particularly in the UK, I've been doing a lot more of that, and finding the odd moment to practice my steel pan skills.
Very good. Premier?
When I stop working, and I'm serious, I keel over and go to sleep.
Very nice. Well, hopefully there's some inspiration for you all there while you stay home, Cayman. Thank you very much for joining us this afternoon. A reminder that you could please visit gov.ky/coronavirus. We are updating that page for you daily. Thank you very much. We'll see you again soon.
Tomorrow.